Now let's discuss voltage sensitive sodium channels in detail. Now these are similar to the voltage sensitive calcium channels, as both have a pore, that is the channel itself, allowing ions to travel through them. But these voltage gated ion channels have a more complicated structure. These channels are long strings of amino acids comprising of subunits, and 4 of these different subunits are connected to form a critical pore known as an alpha subunit. In addition to these, other proteins are also associated with the 4 subunits. The subunit of a pore forming protein has 6 transmembrane segments. Of these, segment 4 can detect the difference in charge across the membrane and is the most electrically sensitive part and functions like a voltmeter. It can thus alert the rest of the protein and begin conformational changes of the ion channel. Now each subunit of a voltage sensitive ion channel has an extracellular amino acid loop between transmembrane segments 5 and 6. This serves as an ionic filter and is located in a position so that it can cover the outside opening of the pore, and thus allowing only sodium ions to filter through the sodium channel and only calcium ions to filter through the calcium channels. Now 4 copies of the sodium channel version of this protein are strung together to form one complete ion channel pore of a voltage sensitive sodium channel. And the cytoplasmic loops of these amino acids that tie the 4 subunits together are sites that regulate various functions of the sodium channel. Interestingly, the loop between the 3rd and 4th subunit of the sodium channel, there are amino acids that act as a plug to close the channel on the inner membrane surface of the pore. Now understandably, the sodium is kept out of the neuron when the channel is closed or inactivated, and the direction of sodium flow is into the neuron when the channel is open. These channels may have one or more regulatory proteins, some of which are called beta units. These are located in the transmembrane area and flank the alpha pore forming unit. They may modify the actions of the alpha unit and thereby indirectly influence the opening and closing of the channel. These alpha and beta units may be phosphoproteins themselves, with the possibility that their own phosphorylation state could be regulated by signal transduction cascades and thus increase or decrease the sensitivity. Both these subunits may have various sites where various psychotropic drugs may act, especially anticonvulsants, some of which are also useful as mood stabilizers or as treatment for chronic pain. There are 3 different states of these sodium channels. The first one is the channel can be open and active. And when a sodium channel needs to stop ion flow, it has 2 states that can do this. One state acts very quickly. It flips the pore inactivator into place, stopping ion flow so fast that the channel has not yet even closed. And the another state of inactivation actually closes the channel with conformational changes in the channel's shape itself. Now there can be many subtypes of these sodium channels. As previously stated, these channels may be the site of action of several anticonvulsants, some of which have mood stabilizing and pain reducing properties.